My name is Magnus Ohman. I'm a professor of medicine at Duke University Medical Center in North Carolina. I'm also a practicing cardiologist. I work at Duke University in North Carolina, which actually created the first PA program in the United States 50 years ago. So PAs are very mature in North Carolina or in the United States, and there are a lot of them in practice. I worked with PAs ever since I came to Duke in 1987. In various capacities, they have assisted in outpatient medicine, participated in assisting surgery, or they have worked on inpatient units. In all the capacities, they fulfill a very important role in the healthcare system in North America now, mainly because, as is common in most countries around the world, the demand for healthcare actually always outstrips the resources available for it. I can't speak directly to bringing what PAs can bring to the Irish system, but what I can tell you what they've done in the United States to a large extent, and that is that they have allowed the physicians to focus on the initial care and management of patients. Once a diagnosis is made, then PAs can execute a long-term prevention program, for example, or be of assistance working up patients prior to elective, straightforward operations such as hip and knees and procedures that are fairly routine in the practice of medicine. They will never surpass the physician in any shape or form, mainly because they're there to really work under the direction of a physician. In the United States, you really work predominantly as a team care model where you have nurses, physician assistants. We also have something called nurse practitioners, which is nurses who've gone on to higher level of care. And then, of course, house staff and all the staff that are undergoing education. And the value is that PAs really can form the foundation, sort of steady practice while trainees come and go as they move through rotations. And they also execute plans that have been well laid that take many visits in the outpatient setting and therefore allows physicians to focus on the early assessment and work in this field. So initially, when the PA program started in the United States, PAs actually fulfilled a role that was mostly assisting where house officers were not either working or there weren't enough of them. Now, they're part of every aspect of care, and the interplay between house officers and PAs is really terrific. The house officers recognize that they're there predominantly to learn and gain experience. The PAs actually provide a backbone to the continuance of practice in many settings, and therefore setting standards for quality that is essential in today's medical care environment. The physician actually enjoy working with PAs because when they worked in a particular setting for 5 or 10 years, they have a lot of experience and they're actually very knowledgeable about areas. They may not be the perfect diagnostician, but they're certainly there to sort of assist physicians in their best practice.